time to be well with your health. Welcome to the Adventist Healthcare and You podcast. I'm Shanna.
And I'm Nimit.
We're back, and we have a wonderful topic today, continuing our series on mental health. And we have a guest that I've known for many years now, Nairi Price, who is the Director of Therapeutic Services with Shady Grove Medical Center and our Behavioral Health Services. She's also a clinical social worker. Welcome, Nairi.
Thank you. Excited to be here.
Thank you. So one of the things we want to talk about today is we talk all the time about the physical symptoms that may send us to the ER. Chest pain, stroke symptoms, broken leg, severe cut.
Yeah.
All of the, we know essentially what would send us to the ER for something physical. What we don't talk about is what may send us to the ER or what to look for in a emergency situation regarding our mental health, because that is just as important as our physical health. And there are services for that. There's a lot of people that may not know that and how that works. And so you're here to talk about that.
Yeah, I'm excited to.
Thank you. So what is it that you do here at Adventist Healthcare? Let's start with that. Tell our listeners how you help our community and patients.
Great. So I oversee our social workers and our professional counselors that work on our units. We have 7 units at our behavioral health site on Shady Grove campus. And so my therapists do the group therapy. They do initial intakes. They do a lot of coordination with family members and the community and making sure that the patients, once they leave our facility, we do a warm handoff to community providers. But ultimately, we're here to serve. We want to make sure that our patients get the treatment that they need when they're in that acute state. I also oversee codependency program, and we also have an adult partial hospitalization program. So I have clinicians there, and in both of those spaces, it's group therapy modality. And so patients come from the outside and come into our space and receive that group therapy for a full day.
Okay, thank you. So we're here to talk specifically in an emergency situation. So what may happen in a mental health emergency? What are some symptoms and what should we be looking for?
Sure. So, if you're having persistent, overwhelming feelings of wanting to hurt yourself, and even if it's more of a thought, but maybe you don't have a plan, but it's persistent and overwhelming and it's something that you can't shake, I would recommend coming to the ED. It could be related to chemical dependency. Maybe you feel overwhelmed with, you have a desire to be sober and you are struggling. We have many people that come in just for services for that. And what happens when you do come into the hospital for those type of services is that we have a licensed clinician that will assess you and determine, are you safe to go back into the community with resources? Or do we feel like you reach a level of care that you need additional supports, meaning that we don't feel like you're safe enough or you don't feel safe enough being out on your own, where you feel like you need additional oversight, medication management. And so we would recommend that you come in and be admitted. And there's different ways to be admitted. Obviously, we would love you to come in voluntarily and be in agreement with us that you want and need this help. Yeah. But there are times where, unfortunately, someone may not honestly feel like it rises to that level, but as our, licensed clinicians do their assessment, they identify that there are some concerns, like you can't keep yourself safe. We look for protective factors, things like that. If you can identify or share with us those things, then we might say, we really want you to come in. And if you don't agree, then we might have to basically certify you and you would have to come in involuntarily.
Okay.
So it sounds like there's a lot of services offered once they're coming into the facility, and depending upon what their needs are, they could go to the right stakeholders or right departments even.
Correct.
So if I'm having some sort of mental health crisis and I'm debating about going to the ED, what are some of the things that I should know before I go to the emergency department? What are some of the aspects that I should consider before coming to the hospital?
Sure. Let's say you're in that space where you don't know. Yeah. I would recommend starting off by calling 988.
Okay.
That is our mental health support, similar to like 911, right? You call there, you're having a state of emergency, and then they sort of route, either EMTs to you or the police. So in this case, you call 988, you explain your situation. They're licensed clinicians that respond. They either kind of talk you through whatever that is. Sometimes that's all you need. Sometimes it does rise to where they need to send out personnel. And usually it's a police and a social worker that goes out, just because, again, we understand the sensitivity of mental illness. And a lot of times it could be triggering if it's just the police. So the social worker goes out with the police to sort of give that extra care and try to understand better, like from a mental health perspective, what's going on and what do you need. And sometimes they may recommend come to the hospital, to the ED.
Just like if you call 911, the police may come, but so do EMS, who are trained to handle, an emergency health situation. This is the same.
Exactly.
So I was thinking about that when you were saying too, you may come into the ED and you may need to be admitted because you need some extra. That's just like if you were to have a heart attack or stroke, you have to stay to ensure that you get the right care that you need to set you up to go home safely.
Correct.
It's the same when it comes to your mental health too. And I sometimes I think we don't think about it like that,
Right, yeah. With mental health, you don't see it, right?
Yes.
Like if I have a broken arm, you see my arm is broken, right?
And you're clearly in
Right.
pain.
Yeah.
And
you feel the pain. Yes.
Right?
Yes.
But many times with mental health, people suffer in silence.
Yes.
Which is challenging. They feel like they can manage it, and they just don't feel comfortable seeking supports. And so you're right. We tend to, because we don't see it, sort of like, is it real?
Mm-hmm.
And so I think people, and there's a stigma with mental health as well, and so I think for those reasons, people may be apprehensive of coming in, when truly there are services that you can really tap into if you just trusted just the process.
Yeah.
But I do like the fact that you could call 988 whenever there's an emergency crisis going on for them, so they could help navigate what they should do, whether it be, help de-escalate what they're feeling, or directing them to the emergency department or their nearest local hospital so they could get the right help.
Because we don't talk about it that much.
Mm-hmm.
People don't know what to do in a situation. They know what to do when they're not feeling good.
Right.
But it's not necessarily thought about in the same sense, So that's a great resource. And that's newer.
That's within the last year or two.
Is it? Okay.
So it is fairly new, and a lot of monies and resources have been poured into it. It's a great resource to have.
Mm-hmm.
And certainly if I were having a mental health crisis, I would prefer a licensed professional than a police. Not to say the police don't understand, but I would, given that it's a mental health issue, I would want the experts that's in that field to come and provide that support to me in that moment of like dire need.
Mm-hmm.
Yeah, I think it's a team approach, just like the hospital. You have the doctors, the nurses, the therapists. So that's a team-based approach, similar to in the community, where you may need a licensed provider and police officer at the same time, depending on what the needs are.
I was going to ask, you talked about some of the services that we have throughout our behavioral health program. What is unique? I mean, the fact that we even have all of these is great, and maybe not a lot of people know about that, but what is special or unique about the programs available under Shady Grove Medical Center and Behavioral Health?
The hospital itself, the unit, I say that very loosely because it's a 133-bed capacity.
I didn't know how many beds we had there
Similar to
either.
a whole hospital capacity.
Yes. And so we're the largest in Montgomery County and the second largest in the state of Maryland.
Oh, okay.
So it's pretty significant, the amount of the community we can serve.
Yeah.
And we do service, like I mentioned, voluntary and involuntary patients. So we have 2 adolescent units, and then we have 5 adult units. Mm-hmm. And they just range by different presentations. So we sort of match your presentation to
where you need to be.
The unit, yes.
How does someone access that? Do they have to come through the ER to access that? So it truly is, if you need emergency services.
Correct.
And then you'll then go into the program.
Correct. So yes.
Or I don't know if you would call it program, but and then you're admitted and
yes, into the
taken care of.
Space. Yes.
Yeah, taken care of just like you were admitted to the hospital.
Correct. So yes, to access those services, you would have to come in through the emergency room. Like I said, you would be assessed by a licensed clinician who would then determine whether your symptoms rose to the level of needing inpatient. Obviously, we want to choose the least restrictive level of care, right? You know, if your symptoms or your presentation can be serviced out in the community, then we would give you community resources. And sometimes those community resources are within our Adventist healthcare system. So, for example, if you needed a therapist and maybe medication management with a psychiatrist, we have our outpatient wellness center. So that's a space for individuals who just need more maintenance.
Yep.
And then from there, we have our adult partial hospitalization program. Now, that you can come in from the community. You don't have to come in through an emergency room. Your community provider can make a referral for that program. You can contact the program. They can sort of do an assessment to determine if that's the level of care you need. And that program runs from 8:30 to 3:30, Monday through Friday. So you're there all day, and you do groups, and the groups are given. We have expressive therapists doing groups. We have our licensed clinicians doing groups. We even have a nutritionist that comes and does groups. We have a certified peer recovery specialist who also provides groups. So it's a well-rounded, holistic approach.
It's a very holistic approach.
Yeah, that's what
really nice.
and
with a lot of different departments.
And integrated too, right? If this part of our services don't match your needs, then we have another level.
Right.
Or another level, you know, and so there's options,
Right, exactly.
Which I think is important for people to know is that it's not an all or nothing sort of thing, right? There's options, and you have options, and you're not alone in that.
Right. And it's great that on site we can provide that level of referral. So it's truly a warm handoff. You know, my clinicians in the ED can reach out to our PHP program or partial hospitalization program and make that sort of warm handoff and connection and get that patient right into those services. I also want to add that we have our chemical dependency program, which is a chemical dependency intensive outpatient program. So they service individuals who have co-occurring diagnosis, which means that they have mental illness as primary and then they have substance abuse as a secondary diagnosis. So it's exciting that, you know, we really truly can provide care for the full gamut of mental health needs of our community.
And what I like is that just because I came through the ER doesn't mean that I'm automatically admitted to the hospital.
Yes.
As you said, that they could be placed into different programs or be admitted to the hospital, but also some of them may not need to be admitted or be part of the program. They may just need some crisis resolution, and they could be discharged with some community resources and follow-ups. Is that what I'm hearing from you?
Yes. So yes, just because you come into the ED, I would hate for people to feel like immediately you're going to go inpatient.
Right.
I'm excited that we do have just these different
Other
levels
options.
of care and options because it's individualized, right? Like it's not a one stop you come in and you have to go into an inpatient unit. Again, we really want to treat you in the least restrictive space.
Yeah.
And so we, the clinicians are really good about determining like what that level of care should be for you.
That's great.
I know this wasn't one of the questions that we have for you, but I wonder if, you know, we sort of like, you know, just because you go doesn't mean you're going to end up in a certain place or anything like that. Is there a myth or or just something that you want to share or that you see a lot that you want to dispel here or that you want people to know about when it comes to their mental health and in an emergency situation or just in general?
I would say there are licensed individuals that really, truly have passion for this work and really, truly want to see individuals who have mental illness flourish and feel and know that they can. And so, you know, my team, and I'm not just blowing them up, but they truly have a passion for the work that they do. And, you know, they think about ethical things. Like it's not, again, we're not just trying to bring everybody inpatient. We truly want to meet the patients where they are. And I'm excited that I get to work alongside team members that have this passion for this particular like vulnerable population.
Yes.
So I don't know if that answered your question.
I think it does
but
because I think there's notions of, you know, it's like in the movies or, you know, on TV shows where it's, you know, the people don't care about you or as you say, they're just putting people away or something like that. And
Yeah.
that's truly not what it is.
No, and even when they get to the hospital, again, like in movies, people are drugged up and sitting in chairs.
Yes.
That is not, the units are super interactive. You are encouraged, if not expected, to attend groups. And, the groups that we provide, they run the gamut of psychoeducation. We do music therapy. We do art therapy. We have drama therapy. We have Tai Chi. We have yoga. So we really are trying to provide like these additional coping skills and like teach these. Sometimes patients come in and they don't have any coping skills.
Yeah.
And so the first time they're ever presented or exposed is when they come to our units and they're like, oh, Tai Chi can calm me down. And so we expose our patients to the different modalities of treatment in hopes that they will engage in these when they leave, just have these things in their toolbox so that, as they're going through life's, just life and things happen and, they can pull from these things, if they connect it with the music therapy modality, right? So then they know, okay, when we did music, it calmed me down. So let me try that now. So I'm excited that my clinicians and that I have a gamut of clinicians who have these different skills to provide to our patients. And so, again, the patients aren't just sitting in chairs and staring out the window.
No, they're actively participating.
Yes, and that's the expectation. And, you're seen by psychiatrists on the unit daily. You have a nursing team that's there daily with you. The clinicians are there. You have even care navigators or discharge planners. So it's a full treatment team, and everyone is engaged in that patient's journey, and they want a positive outcome for them. And so everyone is really like engaged to making sure. And so we want to make sure, like we pride ourselves on our programming just to make sure that, again, the patients just aren't sitting and doing nothing.
Yeah. I love that. Thank you.
I can hear the passion in
Yes.
your voice. And part of me just wants to come to
it.
therapy myself and like learn a lot of those skills because I think just from a mental health aspect of it, just like trying to strengthen and build that resilience, I think having some of those therapies is hugely beneficial.
We take care of our physical health. We have to take care of our mental health too. And, it's good that we take that into account for everyone, right?
Yes.
In a emergency, just to go back to that, you mentioned some of the symptoms that someone might be feeling that would make them go to the emergency department. What about if you were a friend or a family member, a loved one? What type of things should you be on the lookout for to be able to get your loved one, friend to the right place?
Sure. So, like if you notice your friend or family member isn't enjoying the things that they used to do, they're isolating more. Sometimes they may speak probably with ambiguity, but, I don't want to be here anymore. I don't want to do life, just it's not a clear, but those things should pique you to maybe start asking more questions. What do you mean by that? Do you feel safe? How long have you been feeling this way? And then directly asking, do you feel like you would hurt yourself? Yeah. And sometimes it could be uncomfortable, but if you think about it in the sense that you could be saving their life, right?
Yep.
Because you could be the only person that has asked them that just so plainly, right?
Yep.
We get busy with life and people, how are you? And you say, fine, and you keep moving, right? But we know when something's off with our friends and our loved ones. And so really tapping into that and just taking a moment to say, talk to me more. You sound a little off. What's going on? How can I support you? Really can go a long way. And you could be the one person that really sort of took a pause to really sort of check into their mental health where no one else has. And that could be the opportunity or just the thing that they needed to prompt them to get services. Or it could be like, let me go with you to the emergency room to get accepted.
Hold their hand.
Yes.
Offer them the support that they're not alone.
Right.
That's wonderful. You mentioned 988 as a resource. Are there any other resources in the community that people can be aware of?
So I'll go back to Adventist Healthcare because we do have quite a bit of different groups that we provide. I want to give a shout out. We do a parent support group right at our hospital where we provide support for just parents that have children that are just, sometimes you don't even know what it is, right? You just know something's not right. Yeah. And it could be anything from like maybe they're indulging in substances. Maybe they're isolating. It could be school triggers, and so we offer a parent support group that meets on Wednesdays at 6:30, and that's for the community to come in and just have an expert just be able to talk to them and share like resources. We also have speakers come to that. We invite NAMI to come. Again, that's a resource for individuals having challenges with mental illness. They have a slew of different groups and just resources to connect you to the right behavioral health supports, whatever that looks like for you.
And for our listeners, what is NAMI?
Oh, yeah. It's the National Alliance for Mental Illness.
Okay, so that's a great resource
Yes.
for people too.
Correct, yes.
All right, thank you.
Yeah, I just want to give a shout out. We actually partner with NAMI, and so
Okay.
they actually come to our lobby.
Oh, wow.
Once a month on Wednesdays. So they come and it's a support to the family members and the visitors that are coming to visit their families.
Oh, that's great.
So it's great. And again, it's just connecting them to resources. We also have Mindful Eating, which is a 5-week series. And we're hoping to add Coping with Chronic Conditions support groups soon as well. And those are all provided, again, by Adventist Healthcare.
To give some plugs on the chronic health conditions and a mental health aspect of it, there's a podcast. So check out, for our listeners, there's a podcast on that one that you can check out. And then also, you mentioned chemical dependency. We will do a deeper dive into that too. So for our listeners, you can check out that one as well.
You mentioned some of the resources. We do have another resource with the Serenity Spot at Rio at Gaithersburg. Can you explain to our listeners what the Serenity Spot is?
We actually partnered with the Rio. When I say we, my expressive therapy team partnered with the
Well, and that's an important thing to say, right?
Yes.
This is guided by their expertise to ensure that it meets the needs or presents to the community in a well thought out and very special way.
Right. And it's a beautiful, tranquil spot where you go, and it promotes like meditation.
Mm-hmm.
It promotes like a sense of calmness. It's located, as I mentioned, right at the Rio. There is a QR code there where once you download or scan that QR code, it goes to a playlist. And that playlist was curated by our recreational therapist. And again, consists of music and art therapy. So it is very intentional around like those tranquil thoughts and promoting, that level of healing and just
Of mindfulness and peacefulness. And, you think about the Rio here, it's a bustling activity, and we're all participating in our lives, and it's a spot where we can just stop and take a breath, download some resources to help us throughout any part of our day.
Yeah, and the whole area is so calming too, with the lake, with the little playground, and it's just really nice.
The kids are yelling, but
the kids are
out
yelling.
with the playlist.
right.
As a new parent, I enjoy the playground as
there
well
you
with
go.
my son.
Yeah. But it does. I mean, it's a bustling place, but right in there is a spot where you can just stop and take a breath. So that's a great thing that we do. Nyree, we like to ask a lot of our guests, what is one tip that you have, and maybe it's more than one, and that's okay, for our listeners to have a happy, healthy life?
I would say really being purposeful about self-care. And it's an area that I myself struggle in because, again, you just get busy with life. And, when you have kids and other family members, they become priority.
Yeah.
But I would say if your cup isn't full, you can't serve anyone else. And so, and I think that just serves for your overall mental health is taking that moment out, whatever that looks like for you. If it's a walk on a Sunday, if it's, reading a book, if it's going to get your nails done by yourself or a massage, like just really being purposeful of just taking some time away, even if it's just an hour, of just focused time on yourself, doing something that you enjoy doing and that you choose to do, but being purposeful and making sure that you get it in and getting it in, not accidentally, but truly even like scheduling it in. So every Wednesday it's from 6 to 7. And I tell my family and my friends, like, don't reach out to me because that is my time. And I don't have to necessarily tell you what I'm doing, but it's just my time to
take care of yourself.
To take care of myself. And so I would say that goes a long way in just promoting your own mental health.
Yeah, I think many people know what self-care is and what they should do, but just being purposeful and intentional about doing those things, even though if it's small thing like going mowing your lawn, I find really great therapy.
Serenity while you're mowing the lawn?
Yes, I do.
Yeah,
And my
mine
wife
is
makes
cooking.
fun of it.
I love cooking, yes.
I do. I identify with that. I have a large yard and
Yeah.
just putting some headphones on and
Exactly.
and just it's going in that line and back and forth. It's very,
Calming.
Yeah.
But I agree, being purposeful and intentional on self-care is very
I like that word purposeful about it. Yeah. And not by accident.
Not by accident.
Not by
It won't
accident.
happen.
All right. Well, thank you for being here today. We hope you'll come back again. And to learn more about our mental health services, please visit adventisthealthcare.com/mental health. And don't forget to subscribe to our podcast so you can get all of our new episodes. We will put a lot of the resources Nairi talked about today in the show notes. So please check those out. And be kind to yourself. Be well.